Hi, I'm Dr. Chhavi Mehra. The last time we talked about pre-diabetes, but today we'll talk about the various kinds of diabetes, which is type 1, type 2, and type 1.5. Type 1 diabetes usually happens to children under 10 years of age and makes about 10% of all the diabetes that happens in the world. It is usually from an autoimmune destruction of your beta cells of your pancreas. So there is no insulin or very little insulin that's produced. A person is then dependent on taking insulin for any carb that they consume all their life. This kind of diabetes cannot be reversed but can be managed through lifestyle. The next type of diabetes is type 2 diabetes or adult onset diabetes. This usually happens, as it says, in adulthood and makes 90% of cases of all diabetics in the world. Our bodies become resistant to our own insulin and we lose sensitivity to the insulin, and usually overweight can be the cause of this kind of diabetes. This diabetes is reversible. Management of type 2 diabetes requires lifestyle modifications, especially weight loss. Oral anti-glycemic medications work, and in some cases when type 2 diabetes has been there for a long time, it does result in insulin deficiencies and patients need to take insulin. The third kind of diabetes, which is very rare and I think becoming more and more prevalent, is the type 1.5. This is the kind of diabetes that happens to people between the ages of 20 to 30 years, and the two main causes of that is something called latent autoimmune diabetes of an adult called LADA, and the second one is the mature onset diabetes of the young. LADA happens due to autoimmune reasons and destruction of beta cells, and MODY happens due to a genetic defect in a chromosomal structure. And both of these end up needing insulin as we get older. But in a lot of cases, LADA and MODY can be managed on just lifestyle modifications for many years before the pancreas or the beta cells are unable to make insulin and insulin is needed for treatment. In this session, we discuss the various types of diabetes, and in the next session, I will discuss with you the effect of water on your sugar levels. Until then, have a great day.